Good morning. It's 9:30. We're going to start our class today. Today's class is on yoga therapy for cellular healing. Let me explain a little bit before we start the practice. Yoga is an anglicized word of the Sanskrit word yog, which means union. It's a philosophy called Yoga Sutra of Patanjali, 196 sutras or aphorisms, of which 193 of them to control your mind. Practice is called Patanjali Ashtanga Yoga, 8 limbs of yoga, Yam, Niyam, Asan, Pranayam, Pratyahara, Dharan, Dhyan, Samadhi. It's a step-by-step practice towards your union of body, mind, and spirit. Yoga therapy is the adaptation of the same philosophy and practice based on patient's clinical condition. A daily practice of yoga causes two things. First, called Rogir Chikitsha, treatment of a disease, and called Shastharokha, maintenance of health. This maintenance of health acts like a preventive medicine, preventing any disease to come to you, especially at this time of coronavirus. The health comes from healing, and the word healing is called whole. That means it is a holistic practice. Holistic means a healing of your both body, mind, and spirit. If you think about in a computer metaphor, our body is like a hardware, mind is like a software, spirit is like a programmer. So if you fix your software, which is your mind, your hardware will get fixed. But we also fix the hardware. How to fix the hardware? The first fixation of hardware is a relaxation response. Able to sit down in a asana called Sthiram Sukham Asanam. Sthiram is the stillness, Sukham is the happy, Asana is the pose. The healing has to be at the permanent cellular level. In yogic tradition, we are not interested about the disease you have, we are interested about the person who has the disease. So think about a condition where a person is going to have his or her last breath. We call a person expired. So when you expired, your lung stops. Then your heart stops, then your brain stops, your cellular function stops, and the person is pronounced dead. So improving your lung function is going to improve your heart function, going to improve your brain function, going to improve your cellular function. That is the ultimate cellular healing. Breath is also the connector of your body and mind. Metaphorically, if you think about a person flying a kite, the roller is your body. The kite is the mind, and the thread connecting the roller to the kite is your breath. So the breath, the pranayama, quiets down your mind. So let's start our first practice. To get a cellular healing, first you have to fix your software. What is your software? Is your mind. And what you are going to fix? You are fix all the bugs in the software. For example, you get this software updates. You get a software updates in your, say, iPhone or in your Apple Watch. You update and the software gets fixed. Same way, in our day-to-day life, with our lifestyle-related disorders, first, our mind alters. That means our software gets a bug. A daily practice of the yoga is a fixation of that bug. So let's try. First, remember, a physical body response is called a relaxation response. A relaxation response is called activation of parasympathetic tone. Our whole disease process, or the process of not having healing, is due to sympathetic overdrive, fight and flight response, which is happening now. As much coronavirus is affecting us, the fear, panic, and anxiety is killing us more than the disease itself. So the mind is very important. So the relaxation response, parasympathetic activation, and sthiram sukham asanam. Next, your mind is connected to your hand. These are called mudras. And we'll do the mudras to quiet down our mind. Then we have our breath. We are going to use our breath to quiet down our mind. Fifth limb is called Pratyahara. Pratta means reject. Ahar means intake. Intake means all the information you receive through your five senses. I hear, I see, I smell, I taste, and I touch. And able to control the five senses. And then our brain has a frequency. We create a vibration. Two frequency interacts and it quiets down our brain and mind. That is called harmonic resonance. We'll do called Bhramari Pranayama, bumblebee breathing. Finally, to complete relaxation to bring in, we'll do pumping and cupping. And pumping and cupping, it relaxes your eyes, relaxes your all the head and neck area. So if you're able to sit down in the ground, if you can sit down, put your feet under your knees, you cross, and remember always in every yoga practice, keep your spine straight. In Sanskrit, the word we use called Merudanda Achal. Merudanda is spine, that means spine is straight, and Manasthir. Mind has to be still. And you know the outcome of yoga is a Chitta Vritti Nirodha. Chitta is the mind, Vritti is a chattering, Nirodha is a quieting down. Quieting down the chattering of your mind. You don't have to sit down in the ground. The whole practice of yoga could be in a chair. And in West, we call it chair yoga. But always keep your spine straight. So the way to do it, if you look at that, if you're in a chair, if you're sitting in a chair, let me get a chair for you, and you will see that if you sit in a chair, always sit down with your spine straight. Keep your spine straight. This is at a right angle. I have people with so many neurological disorders. multiple sclerosis, your Parkinson's disease, I first ask them to sit down with their spine straight. And believe me or not, in a short time, they start feeling the relaxation response. The Parkinson's disease starts to go away because spasticity goes away. If you sit down all the way to the back, go to the back, but always keep your spine straight. Always keep it straight. That means that's the way you're going to drive your car. That's the way you're going to eat your food. And even when you're standing up, consciously keep your spine straight. So if you're standing up, you will be trying to keep your spine straight. Once you keep it within your consciousness, you are going to do it all the time. And that is the practice of yoga, the daily practice of yoga. Another component you need to learn in yoga practice is that balancing both sides. So if you're able to sit down here comfortably, you sit down. But you listen to your body's signal. If you have feel any pain, that means you crossed your limit. You create an imbalance in your physical body. What do? You back off. But you back off, you stay in the pose. You stay in the pose until you have any discomfort. We call it a comfortable discomfort. Another yogic principle is Annamaya kosha to Pranomaya kosha. We have 5 koshas or 5 shit. Manomaya kosha, Vijnanamaya kosha, Anandamaya kosha. That means any imbalance you create in the physical body, it shows up in your breath. So if you're going to do it forcefully here, you will feel you have an effort in breathing. So the asana practice or the poses practice should have no pain and effortless breathing. Effortless breathing means you are able to talk, you are able to sing. It's very important. Next concept is you change your feet, see how you feel and how you can sit down. You will feel your one side was easier than the other side. Why? Because we have lateralized. I'm right-handed, right-footed, my left brain is working, and my left side of the body is not working properly. So bringing the balance back in your body is your cellular healing. Cellular healing is called balance of your body, mind, and spirit. Always practice both sides. You will see when you do Gomukhasana, we'll do equally on both sides. When there is no equality, then the healing doesn't take place. Also, there are some signs of proper health, proper cellular healing. They call strong digestion, which is called your Agni, Jathar Agni, easy elimination, proper elimination of your urine and stool, and a good night's sleep, primarily a dreamless sleep. And we'll do 5 asanas to improve your digestive fire, 5 asanas to improve your elimination, and asanas to improve your sleep, especially to getting a stage 4 non-REM sleep. Sleep has 2 components, REM, rapid eye movement, which is still mind is active, non-REM sleep. In non-REM sleep, stage 1, stage 2 is almost 50%, which we are always in due to our meditation practice. We get into stage 3 and 4 sleep. So able to sit down, this is called Sukhasana, easy pose. Keep your spine straight, use your hand. Our universe is made of 5 elements: space, air, fire, water, earth, and the 5 elements is also in our hand. Space is the middle finger, air is your index finger, fire is your thumb, water is your little finger, and earth is your ring finger. So able to touch the fingers. When you touch your index finger and thumb, Canno Mudra, Canno Mudra, it quiets down your mind. If you bend your index finger down, put your thumb in the top, Vayu Mudra. You are controlling the air element, the Vata element. It controls your pain. It controls your stiffness in the body, joint pain, arthritic pain. Touch your middle finger and thumb, called your Shunya Mudra. Improves your hearing. Touch your ring finger and thumb, Prithvi Mudra. Is your grounding elements for diabetes, for obesity. Touch your little finger and thumb. This is your Varun Mudra. Water element controls your bladder, fluid contents in your body. Touch your ring finger, little finger and thumb, Shakti Mudra or a Prana Mudra. It brings the prana, the life force. We'll talk about this doing all the pranayama practice with your Prana Mudra. Middle finger, ring finger and thumb, Apana Mudra. Apana Mudra is your Pachan Mudra, digestion mudra, elimination mudra. Putting an index finger down, punch your Apana Vayu Mudra. It improves your cardiac function, pulmonary function. A lot of other mudras are there. You can do the called Linga Mudra. This is a very important mudra. And also before we start, let's do one very important, the healing process, which is, remember, you are doing it 24/7. Yoga is a 24/7 practice. So the first, the mind has a few components which yoga needs to take care. The first component of the mind is not able to focus. Second is your anxiety. Third is the imbalance because you're using one side of the brain. So let's just show you the three mudras which you need to do all the time to quiet down your mind. So you notice when I'm sitting down talking to you, my tip of my fingers were touching. This is called Hakima Mudra. This is to bring a focus. And I sit all the time. I go to a conference, I'm sitting down, even with my eyes closed, somebody is very listening carefully, their hand goes like that without knowing. For anxiety, it's called Shankha Mudra, conch shell. Two hands, see if you can do with me. Use your right hand, wrap around your left thumb. Left hand around your right hand, then touch index finger and thumb. It looks like a conch shell. Shankha Mudra is to get rid of the anxiety of your mind. You can always do the opposite side equally. Now use your left hand. So left hand wrapped around your right thumb. Right hand wrapped around your left hand, touching your index finger and thumb. We have been doing it for so long. What happens for us is that we can always do even accessing your subtle body. Like close our eyes. I can do it closing my eyes. Right hand wrapped around your thumb, touching your index finger. This is called Shankha Mudra, quieting down your anxiety. So this is to bring focus, then remove anxiety, and then to bring the balance is called a Dhenu Mudra, touching opposite fingers. Right index finger touches left middle finger. Right middle finger touches left index finger. Right ring finger touches the little finger touches the ring finger, thumb touching. This is called Dhenu Mudra. It balances both sides of the brain. So again, I want to show it to you. If you want to practice with me, you can do the eyes closed. My eyes are closed. My right index finger touching the left middle finger. Right middle finger touching the left index finger. My right ring finger touching the little finger, and right little finger touching the ring finger, and a thumb is called udder of a cow. This is your Dhenu Mudra. Practice daily and you'll see your mind will quiet down, physical body will get healed, and cellular healing will take place. So by this time, I feel relaxed enough, I can go progress. It is called in stages, impossible become possible. You can take your heel all the way to the back. You can take your one foot in the top and your knees drops down. This is called your Siddhasana, perfect pose. You can see my knees are dropping down. I'm not doing anything. Say if it is here, let it be here. If you push it down, it's going to come back higher. But more and more relaxation sets in. This will happen to you. Spine straight. Touch your index finger and thumb. This is your Canno Mudra, Dhyana Mudra. Put it gently over your knees. Quiets down your mind. And close your eyes. Remember the five senses. You hear, you see, you smell, you taste, and you touch. But most powerful of your five senses is your vision. So you are quieting down your vision. Then comes your lung. Bring your awareness to your breath now. Lung is like a balloon. Its vital capacity is 4.5 liter. Residual volume is 1.5 liter. Total lung capacity is about 6 liter. We only breathe. The tidal volume is about 500 cc, 0.5 liter. So learn how to breathe out first to empty that lung. Take a deep breath in without any effort. Remember all the breathing practices you do without any effort. Then breathe out longer than breathing in. If it is twice, it is better. Slowly and slowly, you can start increasing the amount of air you are breathing in, amount of air coming out. Why? Because the muscles to control your breathing are called skeletal muscles. They can be trained. You can train your biceps muscle to doing your practice of weight training. That's the way you do it. So let's do it a couple of times. Let's do it count of 2 in. The way you count, that counting is also quieting your mind. 1 and 2. If you count it too fast, your mind gets agitated. So let's first do very easily. Count of 2 in, count of 4 out. Do count of 3 in, count of 6 out. Count of 4 in, count of 8 out. If you can continue, count of 5 in, count of 10 out. You continue a few more times, so let me tell you what happened. Inhalation is sympathetic, exhalation is parasympathetic. When you extend your exhalation, you get some saliva in your mouth. All the gastrointestinal tract is supplied by parasympathetic nerve. So when you have a parasympathetic activation, you have a saliva in your mouth, like what I am having now. I have a saliva in my mouth. When you get stressed, sympathetic response, you get a dry mouth. Now for cellular healing, in yogic concept, you need to bring a pranic healing. And let me show you one in stages what happened. Now I'm very comfortable and I'm going in stages. Now what I can do, I progress a little bit more. My next progression is putting one foot in the top. This is called Ardha Padmasana or called Swastika Asana. If you cannot put it here, if you have a pain, you back off. But you have a pain, you start somewhere. Don't say, I have a pain, I'm not going to do it. You do it a little short of pain. If it hurts here, do it here, or maybe do it here. But start where you can. And then you bring the prana with your breath, called pranic healing. Pranic healing is at the cellular level. In yogic tradition, our lung doesn't only breathe, our whole body does the breathing. Our skin is doing breathing. Our every internal organ is doing the breathing. And prana is the life force. It is an energy which keeps us awake, alert, and alive. Breath is not prana. Breath is the carrier of prana. In metaphorically, prana is like an electricity, breath is like an electric cable. Let's do a pranic healing. How to do a pranic healing? Touch your index finger, thumb again, or do your Prana Mudra or your Shakti Mudra. Touch your ring finger, little finger and thumb and put it just gently over your knees. You will see one thing, initially your fingers will be a little curved, but don't worry about it. When the relaxation sets in, it will get straightened up on its own. Close your eyes. Now you pay attention to your breathing. You breathe out first. Visualize your breath coming in through your nose. Nose is like your personal air conditioner. It filters the air. If outside air is warm, it cools it down. If outside air is cool, it warms it up. Air goes to the side of the turbinate. Turbinate guides the air, and the air goes into the upper part of the lung, middle part of the lung, lower part of the lung, almost to the level of your belly button. Visualize the air is coming out from lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, coming out through your nose. And outside your nose, the breath is now picking up prana. According to yogic tradition, prana resides outside your nostril. Visualize breath is picking up prana, a subtle energy, bringing the prana inside through your nostril, behind your throat. Now visualize that prana is going first to the organ of healing, then is going to all over the body in the cellular level, causing cellular healing and also called cellular meditation. My last class was meditation is medication. Visualize the prana. For me, I'm visualizing prana is coming to my heart. I have a heart ailment. I had an open heart surgery almost 19 years back. If you have an ailment anywhere, you have a back pain, visualize prana is coming to your back. If you have a knee pain, visualize prana coming to your knee. If you have diabetes, visualize prana coming to your pancreas. Then visualize prana all over the body in the cellular level. And we also say there is called cellular panchakosha. There is 5 sheet koshas: Annamaya kosha, Pranomaya kosha, Manomaya kosha, Vijnanamaya kosha, Anandamaya kosha. In all the cellular level, and prana does a healing of all the 5 koshas. We always say complete healing takes place when our 3 bodies, gross body, subtle body, and causal body gets healed, when our 5 koshas gets healed, and when our 7 chakras get balanced. And that is your cellular healing. It's a powerful practice. Please practice it every single day. Now bring your awareness to your 5th limb, Pratyahara. You quiet down your 5 senses, create a vibration, and 2 vibration cancels each other. You get into a harmonic resonance, a profound chitta vritti nirodha, quieting down chattering of your mind. Bhramari Pranayama. Put your index finger in the forehead. Use your 3 fingers to close your eyes. Use your thumb to close your ear and close your mouth. If you can see, your hearing is closed, vision is closed, your mouth, the smell and the taste is closed. You will breathe out first. We'll take a deep breath in and breathe out to the sound of a bee. Let's do it about 3 times. And if you can do it, let's do it with me. Breathe out first. Take a deep breath in. Slowly take out both the hands. Keep rubbing your hands. Keep rubbing your hands, palming and cupping. When you feel the warmth in your hand, if you're wearing glasses, you remove your glasses, take the hands like a cup, put it over your eyes, let the eyes take all the heat from your hand, then massage your forehead, massage your eyes, massage your face, massage your head and neck. Powerful relaxation response. And this practice, what we have done, you have created a phenomena of software updates, fixing your mind, chitta vritti nirodha, and you are creating your cellular healing. As I said, that you start your practice where you are. There is no competition. You are not competing with anybody. You're only competing against yourself. So I'm competing against myself. This is called in stages. Impossible become possible. In balance, impossible become possible. I put my other foot in now. So this is called also Ardha Padmasana. Padmasana is the most relaxing asana. Padmasana is not that you want to try. Padmasana will come to you when you're properly relaxed. Same thing is for Sarvanga Asana, shoulder stand, Shirshasana, headstand. This will all come to you. Mayurasana, peacock pose. It looks like a very difficult asana. There's nothing called difficult. Comes to you when you relax. So I'm showing it to you that in relaxation, everything happens. Now relax your upper part of the body. We go in stages again. So with the hand. So we learn the whole relaxation from the babies. If you say baby, every posture baby does is a yoga. Baby will get up into a Cobra Pose, Bhujangasana. Baby will get into downward facing dog. Baby will get into Tadasana, mountain pose. Baby will get into Vrikasana. I have pictures after pictures, I show it to you. So if you see the babies, how the hand, remember, hand is very tight. So it's called Balo Mashti Mudra. Balo means baby. Mushti means fist. Baby will take the hand, they'll put the thumb inside and close. This is your Balo Mashti Mudra. And remember I said, always do the practice with effortless breathing. Never hold your breath when you're doing asana practice. So if you put your hands in the front and do with your breathing, like in yogic tradition, you breathe out first. Take a deep breath in. Breathe out, close your hand. Breathe in, breathe out. And when you do with the eyes closed, you will see your relaxation will set in a lot earlier and a lot easier. Wrist gets relaxed with a extension and wrist gets tight with a flexion. Breathe in, breathe out. Breathe in, breathe out. You do it a little longer at home and you will have the relaxation. Now I can show it to you. I'm so properly relaxed, I can take the other foot, bring it up. I can sit down in a called Padmasana, lotus pose. This is a relaxation. So I could get in when I sat down, but I did not. Why? I created a relaxation response, so it will come to me. So I'm very comfortable sitting like this. Shoulder gets relaxed with a little rotation with the breathing. Put your hand in the shoulder, bring it close to you, and then, you breathe out first. If you cannot bring it here, wherever it comes, it's okay. Breathe out first. Take a deep breath in and slowly rotate your shoulder. Close your eyes and slowly rotate, breathing in, breathing out. How long you do it? You do it until you have any effort in your breathing or effort in your practice. Don't compare. Don't say, I'm going to do 2 minutes, I'm going to 5 minutes, I'm going to do 10 counts. Listen to your body. No pain, effortless breathing. By the time you'll be practicing daily like us, you'll be able to do longer. This is your normal, your posture. Do it opposite. Breathe in, start in the opposite side. This is your life. This is a daily practice. We can sit down and keep on doing it as long as we want because our brain has a signal called neuroplasticity. It's habit forming. You can do the hand raising high up. Hold your wrist. Breathe out first. Take a deep breath in. Slowly bring your head down behind your head. With the same breathing. Breathe in, breathe out. Breathe in, breathe out. Very powerful tool. You can also always bring a breathing technique called Bhastrika. Bhastrika is a bellows. Bellows is, we call it a hapur in Bengali, hapur. Like, the blacksmith uses it, or people uses it for the fireplace. So what the bellows does, it takes a deep air in. Do with your eyes closed, it'll bring in. We also, every morning, we do a tongue scraping, we do a gel neti using neti pot, so you get some drainage from our nostril. But doing a Bhastrika Pranayama is entirely normal. Also to keep some facial tissue because you have a drainage from there. So Bhastrika Pranayama, we do it all different ways. But see, when you do for the shoulder joint, if shoulder, you can put your like this, breathe out first, then powerful tool. You can do Bhastrika very gently with the hand raised, very gently with your sitting down is bring the relaxation and brings your cellular healing. So we will do a Bhastrika again. Let's do relaxation is your Adhi Mudra, Balo Mushti Mudra. So eyes are closed, breathe out first. You're taking a deep breath in and out, both active inhalation, active exhalation. I'm showing you the technique so you can do it at home as a daily practice, and then you do it until you have any effort. You can do it a little faster just sitting down with your shoulder shrug like this. Breathe out first, take a you can continue as long as you want. For us, it's not the issue. We can do it sometimes 2 minutes, 5 minutes. We can do it even pretty faster. So we have a 3 state of our being. We are called Rogi. Rogi means people have a disease. Then called Nirogi. People have no longer disease, they're healthy. And the Yogi. Rogis will do very gentle Bhastrika. Nirogis will do a medium pace. I will also show you faster, medium, and a slow speed. So Nirogi. What the yogis will do a lot faster for a longer time, but that is a normal breathing. There will be no effort. This will be like this. I can do it for a long time, for a daily practice. I did about, say, 50 counts. I'll do about 500 counts, maybe 1,000 counts. But still, it does not affect my breathing. I'm still talking. You're smiling. Every asana I do, I have effortless breathing. I'll do a Mayurasana. I'll be able to talk when I'm doing a Mayurasana. I will do a headstand, Shirshasana. I'll be able to talk when I'm doing a Shirshasana. That is your cellular healing. That is the yoga practice. Now, I like to do it also with the arm raised. Why it does? A lot of people have this shoulder, frozen shoulder. A Bhastrika Pranayama is a pain medication. What does it mean? Our end product of metabolism is called glucose. Glucose combines with oxygen, called aerobic glycolysis. It produces carbon dioxide, water, and ATP. ATP is called energy, adenosine triphosphate. You get a more energy when you have a more oxygen in your body. But if you don't have enough oxygen, glucose combines with less oxygen, called anaerobic glycolysis. It produces lactic acid, pyruvic acid, pain-producing substances. So able to do a Bhastrika, get rid of the pain. So we do it in a 3-year speed. First speed is a very slow. You raise your hand high up, breathe out first, and when you pull it down, always pull it down with a yogic fist, like this. You do a speed called Ishwar. Ishwar. You can do it a little faster, medium pace. We call it So-hum. So-hum. So do like this. Here, So-hum. So-hum. It will be this speed. Medium speed. Then also you can do a lot faster. It's called Vishnu. Vishnu, 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 Vishnu. The speed will be practice we do is we do a complete cycle. We do say 10 counts or 20 counts with the very slow, 20 counts medium, 20 counts faster. We call it a 1 cycle. Then we do 2 cycle, 4 cycle, 6 cycle, and we continue doing it. So let's do a practice. One practice, just very simple, just to show it to you. Let's do a count of 10. 10 slow, 10 medium, 10 very fast, to show you how to do this Bhastrika or Bellows Pranayama, and also get rid of all the aches and pains in the upper part of the body, head and neck and the shoulder. I do it with my eyes closed. 10 slow. Medium speed. Ten very fast. You will feel that the whole lung is getting empty. Now if you take a deep breath in and breathe out, you may have brought about 3 or 4 times more air and more oxygen than you normally do. This is called yogic breathing. This is called Dirghashas, 3 steps breathing. Up, lower part, middle part, and upper part. When you're able to do a 3-stage breathing called Dirghashas, Dirgha means long, Swas is the breath, you have a cellular healing. So let's try. Now your lung is little empty, hand is in a Adhi Mudra or a Bala Mushti Mudra. Breathe out first. 3 steps breathing. Notice that I fill up lower part of the lung, second middle part of the lung, upper part of the lung. Most of the time, lower part of the lung, it gets all air, called aeration. Middle part, upper part doesn't get any. But this 3-stage breathing brings the air in all 3 parts of the lung. So let's do the breathing out also 3-stage breathing. powerful practice for your cellular healing. Neck is the very tightest part. When you relax your neck, your body relaxes. Tightness of the spinal muscles in the back is your disease, is your ill health. Relaxation of the spinal muscles. When you're able to relax your neck, you relax your back muscle, relax your knee joint, hip joint, all part of the body, called Brahma Mudra. Brahma is the name of the Supreme Being. Mudra is a gesture. 4 postures, like in a 4 direction, east, west, north, south. Also 4 heads of the Brahma. Do the breathing. Breathe out first, take a deep breath in. Slowly drop your neck to the back. And breathe out, slowly put it in the front. Listen to your body's signal. No pain and effortless breathing. If no pain and effortless breathing, keep doing it few times. Breathe in, do with your eyes closed so you can clearly follow your breath. People always ask me, I have a herniated disc, I have a spinal stenosis, I have some surgeries in the past, I have some plate screws. Nothing will bother you because you're listening to your body's signal. If you don't cross the limit of your pain, if you are in effortless breathing, you are not going to hurt yourself. Do not take a pain medication and do a yoga posture. Second, breathe out first in the middle, breathe in, slowly drop your neck to one side. And the same breathing cycle, come back in the middle. Breathe in the middle, drop in the other side. And slowly bring it to the middle. Third step, looking all the way to the back. Breathe out first, take a deep breath in. Look all the way to the back without turning your shoulder. And slowly bring your head back in the front in the same breathing cycle. Breathe in the middle. All the way to the back without turning your shoulder. And do it a few more times when you're home. Here, I'm just showing it to you how to do the practice. Finally, you rotate your neck very slowly. Drop your head down. Breathe out first. Take a deep breath in. Slowly rotate your neck to the left, to the back, to the right, and in the front. Breathe in here. Breathe out. Always do balancing in the opposite side. So let's do the opposite side. You breathe in here in the middle. Breathe out, start from the right side now. To the right, to the back, to the left, and in the front. So now you are so properly relaxed, you can show the relaxation of your whole upper part of the body. It's called Pushrim Namaskar. You do Namaskar Mudra in the front like this, in front of your heart chakra. Do it in the back. So let me show it to you and see how simple and how easy it is to do it. What you do, you slowly take your hand to the back, and wherever it comes, if it is here, let it be here. If it comes here, you can slowly put it in a mudra, and then if you can get into the mudra, Pushrim Namaskar, Slowly go high up, slowly and slowly, 1 week, 6 weeks, sometimes in your lifetime, you'll be able to do it. Once you are in the Pushrim Namaskar, you see your whole spine is straight. You had a better breathing. Breathe out first. Take a deep breath in. Notice that you can breathe in almost 2, 3, sometimes 4 times the normal amount which is breathing in. And this is the tool for all the IT people. All the people sitting in front of computer, they're hunchbacked, looking at that screen. They get the highest number of lifestyle related disorder. Tell them to do the Pushrim Namaskar and sit down. Sit down for a while with your breathing, and it brings so much of relaxation that your breathing becomes effortless. And your breathing becomes effortless, you are in a state of profound relaxation. And relaxation is the cellular healing. Whole upper body, you do Yoga Mudra. You hold your to the back, keep your spine straight. Look straight. That keeps your spine straight. Breathe out first. Take a deep breath in. Slowly drop your body down and listen to your body's signal. What is a body's signal? Pain. If you have any pain, back off. But stay in the pose where you have a comfortable discomfort. If you don't have any pain, slowly come down as far as you can come down and listen to your breath. I'm still breathing. I'm talking. I'm singing. Slowly and slowly, my whole head will touch the ground, and I keep it here between 5 to 10 breaths. Breathing out longer than breathing in. Can we get up? Slowly get up, one step at a time. Relaxation of the lower part of the body. See, also, when I come out of the asana, you come out the way you came in, but also do it slowly because you are in a relaxation state. Remember the difference between exercise and yoga. Exercise is the muscle contraction. You get in and out of the muscle. It is sympathetic. Your heart rate goes up, blood pressure goes up, respiratory rate goes up, and then when the sympathetic tone goes high up, your body starts balancing it with a parasympathetic output. So what happens? Your heart rate comes down. Your heart rate comes down, your respiratory rate comes down, and you feel the profound level of relaxation. But in yoga practice, it's primary parasympathetic. Keep your spine straight, hands on both sides. This is called a Tadasana. Feet get relaxed or able to separate your toes. You can separate your toes, breathe in, breathe out. I always do, every single day, I do it with my eyes closed. When you're able to separate your toes, you get a relaxation. Your plantar fasciitis pain goes away, bunion goes away. It is a wonderful practice. In fact, the market is full of it. Yoga toes, yoga socks, yoga shoes, but all of them has a toe separator. Ankle joint, you breathe in, breathe out. Relaxation of the ankle joint is your physical independence, because all the body weight comes to your ankle. Knee joint, hip joint transmits your body weight. Breathe in, slowly rotate your breathe in, breathe out. Do it on the opposite side. And I do this practice for you to keep it and for your future so you can able to practice it. Seated forward bend, Paschimuttanasana. Hands high up, slowly wherever it comes. If it comes and touches your toe, is great. Many a time we could even put our hands and clasp it. But slowly and slowly see if you can drop your body down. Keep your look straight, keep your spine straight. Slowly drop it down. No pain. Keep breathing. Breathing out longer than breathing in. If you just go in and out of this, you might even hurt your back. So take your time. Stay in the posture. 5 to 10 breaths. Breathing out longer than breathing in. And then when you get up, use your hand. Slowly guide yourself and go high up. Beautiful practice. In fact, all the relaxation of the toes you can do with your hand. You can take your hand and you can put in between your toes. See, initially very tight, it doesn't go in, but now it goes in and out. You can relax your ankle. Hold your knees, bring it up, hug it. Breathe out first. Take a deep breath in. Slowly let the knee come down. It'll come all the way down without, if it were to come down, if you push it, it'll come back high up. It'll come down on its own. When the knee is relaxed, hip is relaxed. Knee is the site of fear, hip is the site of emotion. Stress is nothing but fear of unknown. Able to relax your knee, control your stress. Emotion-related disorder, hypertension. Blood pressure goes up when you have emotion. Neuropsychiatric disorders, balance it. Use the opposite side. Use your hand to separate your toes. The knees high up, slowly goes down on its own. Knee relaxation and hip relaxation. First time I was giving a talk, what happened? My knee was shaking. The fear starts in the knee. But by the time you keep doing it, slowly and slowly the fear goes away. Neuroplasticity is like a vaccination. Relaxation of the hip is called your Supta Baddha Konasana. Sorry, Baddha Konasana. It's not Supta. Supta is lying down. So here it is. Put your feet together, and slowly let both the hips come down. This is also called Titli Asana. Keep your spine straight, keep your eyes closed, and slowly you will see both of your knees will come down. This also helps in your back pain. This also helps your proper elimination. Now, a sign of healing, sign of health is proper elimination, strong digestion, good night's sleep. So let me show you some asanas which will have your proper elimination. In yogic tradition, it's called Shankha Prakshalan. Shankha is your metaphor of your intestine, Prakshalan is the cleaning. You do it a whole procedure, it's called Kriya. Kriya is the Sharir Shuddhi, cleaning your physical body. You drink 2 glasses of water, do the 5 asanas, 2 glasses of water, do the 5 asanas. But here is called a Loghu Shankha Prakshalan. Loghu is the mild. And you do it for daily practice to improve your elimination. Able to sit down in a squatting pose. This helps in a proper elimination. This is also a powerful relaxer. Malasana. It relaxes your ankle, relaxes your knees, relaxes your hip, your back, and whole body is relaxed. And look at the upper part, separate your hands, fingers, hand get relaxed. Extend your wrist gets relaxed. Put your one elbow inside, other elbow inside, slowly bring it close to you and close your eyes, breathe in and out. No disease will come to you. This is, in Sanskrit, we call Ashuk. Disease is called Ashuk. Aw means no, Shuk is a happiness. This also relaxes your pelvic floor. It straightens up your anorectal junction. There's a kink in your rectum and the anal canal, so you don't get incontinent. By sitting in this position, you get a proper elimination. There is first asana is called your Udar Karshanasana or Shankha Asana. Udar is your stomach, Karshan is a massage. Massaging your stomach will help you proper elimination. There are 5 asanas for proper elimination. This is number 1. Put your hand, bring your right knee in front of your left foot. Left knee, you push it close towards your right side. Keep your spine straight. Take a deep breath in and slowly turn your body in the opposite side. Shankasana, Udar Karshanasana for proper elimination. Come back in the middle. Then to the opposite side, drop your left knee in the front. Use your right hand to push your right knee towards in your left side. Keep your spine straight. Look all the way to the back. Come back in the middle. Shankasana. Next one is called Tirjak Bhujangasana. Bhujangasana is your Cobra Pose. Tirjak is oblique. The way to do it, you lay down on your mat with your face down. Hope you'll be able to see me. Yes, face down. And then separate your feet until the width of your mat. Then you get into a Cobra Pose. Slowly get high up in your body. And then look over your left shoulder towards your right ankle. Then slowly come down here again. Slowly get up. There's no rush. Look over your right shoulder towards your left ankle. Tirjak Bhujangasana. That's your oblique Cobra Pose. Next one is a primary sign of proper healing. It's called sit rise test. You're able to get up without a support. So if you can sit down comfortably, sitting down and getting up without a support. Very powerful tool. Going against the grain of your habit is yoga. So I'm comfortable standing like this. See if I can put my feet together and stand. It's called Tadasana, mountain pose. 2 other asanas which helps proper elimination is called your Utthita Tadasana, upward mountain pose, and Tirjak Tadasana, oblique mountain pose. Take your hands when relaxed, you can clasp, turn it around, put it over your head. You breathe out first. Take a deep breath in. Slowly get your tippy toes and the hand goes high up. See that how beautiful it is? You put your hand here. You breathe out first. Take a deep breath in and slowly go high up. Balancing pose, very, very important pose. And then slowly come down. 3rd asana for your proper elimination. 4th asana, Tirjak Tadasana. Hand goes high up, breathe out first, take a deep breath in, and slowly drop your body on one side. Then come back in the middle. Breathe in first. Go to the opposite side. And come back in the middle. One more time. Tirjak Tadasana, oblique mountain pose. Finally, Kati Chakra Asana. Kati is the west, Chakra is your rotation. Separate your feet, put your hands in the front, and you slowly rotate your body one to the back, and then we'll be again in the opposite side, but then we bring it all together. The way to do it is that the best way to follow your breath, close your eyes, breathe out first, take a deep breath in, slowly turn your body all the way to the back, and the same breathing cycle, come back in the middle. That's the way you also extend your exhalation. Breathe in here, breathe out. It is such a powerful tool. It creates a state of meditation. This is called a moving meditation. This also improves your elimination. One of my good friend, Dr. Arya, is a gastroenterologist. He did a barium meal study with these postures. It's called Shankha Prakshalan, and he has shown that it helps improving your elimination. You can do it with your hand on your shoulder. You can put your one hand in the shoulder and your other hand in the back, and take a deep breath in, slowly rotate your body to almost to the middle. And same breathing cycle, you come back in the middle. Left hand over your right shoulder, right hand goes to the back. Breathe in first, all the way to the back. A powerful tool is called the balancing poses. Remember, when you bring the balance in your body, mind, and spirit, it's a healing. That's your cellular healing. So the balancing poses. What you need to do, balance opposite side. So I am right-handed, right-footed. See if I can stay on the left foot. My balance also depends on my hand. So when I fall down, what happens? I fall down on my hand first. You got a fracture called a Colles fracture. Let's see if I can take our hand. This is called a Pushrim Namaskar. Right hand holding your left arm, left hand putting over your right forearm, holding your right arm. Fit together. See if I can stand on my left foot. Initially, it all becomes very wobbly. 10 seconds feels like 10 years. 20 seconds, at 10 years younger. 40 seconds, at 20 years younger. And finally, it's almost impossible. Balance also comes from a vision. Close your eyes, so if you can the balance. If you can close your eyes and in a balance, you get a proper healing of your mind. That is called controlling your software. This is a proper cellular healing. It's a wonderful practice. I do it every single day, but still I cannot do it. I'm a human being. Probably I will never able to do it because I'll never get healed because we always have some underlying disease. Balance it. Do the opposite side now. The left hand holding the right arm, right hand holding the left arm. Now see if you can do by right side. See, one side is a lot easier than the other side. Why? We're lateralized. Our one brain functions better than the other. Close your eyes. I'm a lot better on this right side than the left side. What you need to do, you practice more for your left side. Another nice tool to show it to you, if you can cross your feet, if you can sit down crossing your feet and get up crossing your feet. It's a wonderful tool for your healing. Doing opposite side, cross your feet, sit down crossing your feet, get up crossing your feet. Another healing, for especially the healing for your whole body, is called baroreceptor sensitivity and chemoreceptor sensitivity. Baroreceptor sensitivity goes high up, chemoreceptor sensitivity goes down. Putting a head below your heart. When you put a head below your heart, pressure inside the head goes high up, pressure inside the eyes goes high up, pressure inside the carotid artery goes high up. But if you keep your head down 1 week, 2 weeks, if you see initially your whole face is flushed, you cannot talk, you cannot breathe. But when the neuroplasticity sets in, which is your habit forming, the pressure starts to come down. When the pressure starts to come down, you develop baroreceptor sensitivity. You get a healing for your body. So a very simple way, you keep on separating your feet, keep on separating your feet. You can do very nicely this way. See how much you can separate, then slowly come down. Put your hand support on your thighs and the leg and stay where you are. Start where you are. You have to start one day. We all started one day. For us, we can go all the way down. We can put our head down. We are so relaxed, you know. This is called Prasharito Utthana Asana. Wide angle. Hand down toward your feet. So relaxed, we can do even our pranayama breathing. I can do Kapal Bhati Pranayama here, like this. You can hear it. It's a wonderful tool. I can keep it down for as long as I want. Therapeutic asana. These are called therapeutic asana. We'll do a little longer today. If you stay with me a little longer, we'll do a little longer class today, because it's a very important concept for cellular healing. So the next one, obviously, what we do is a Surya Namaskar, sun salutation. But you do a sun salutation called therapeutic sun salutation. You do with your breathing. 12 steps. You start with one breathing, finish at the end, and in the second set, you use your opposite foot. Very important concept. And if you have a body type, Vata, Pitta, and Kapha, Vata does very slowly, very rhythmically, and Kapha does very fast. So if you start, hands in the front, Pranamasana. Breathe out. Breathe in, hand goes all the way to the top. This is called your Hasta Uttanasana. Breathe out, hand comes in the front slowly, on the ground, and slowly head comes towards your knee. Padahastasana. Breathe in, right foot goes to the back, left knee is in the front, chest opens up, look high up. Asasanchalanasana, horse riding pose. Breathe out, left foot goes to the back, the heel in the ground. You look at your belly button, Parvatasana. Breathe in, your knee goes to the mat, your chest is on the mat, finally your chin is on the mat, is your Ashtanga Namaskar. Breathe out, get up into the Cobra Pose, Bhujangasana, and breathe in, You go back into Padmasana. Look at your belly button. Breathe out. Right foot comes in the front. All the pressure on the right knee. Chest opens up. Look high up. Asanas. Breathe in. Left foot comes in the front. Hand is on both sides. Head comes towards your knee. Padmasana. Breathe out. Hand goes all the way high up. And then slowly hand comes in the front with a breathe in. Started with breathing out, ended with breathing in. And there is also a mantra with all the 12 asanas, basically the 12 names of the sun. Now we'll do the opposite breathing with the opposite leg now. Balancing, remember the balancing is the key for yoga as a therapy. I wrote it in the book called Dynamic Surya Namaskar, put on a therapeutic sun salutation. Now this time we'll start with the breathing in. I'm breathing out first. Take a deep breath in. Breathe out. Hastottanasana, hand raising pose. Breathing in, hand comes in the front. Head comes towards your knee. Padmasana asana. Breathing out, left foot goes to the back. Right knee, all the pressure comes, chest opens up, look high up. Asanas. Right foot goes to the back. You look at your belly button. Padmasana, breathe in. Breathe out. Your knee goes to the mat. Chin goes to the mat. Your whole chest is on the mat. Ashtanga Namaskar. Breathe in. Get up into a Bhujangasana, Cobra Pose. Breathe out. Get into the mountain pose, Padmasana. Breathe in. Left foot comes in the front. All the pressure on the left knee, and you look high up. Asanas. Right foot comes in the front, hand is on both sides, head touching the knee. Breathe out, Padmasana. Breathe in, hand goes all the way to the back, Hastottanasana, and breathe out, Pranayama. Started with the breathing in, came down to the breathing out. So one very therapeutic asana sitting down, which does balancing, is your Gomukhasana. Another relaxation is your Vajrasana. If you're able to sit down in a Vajrasana, that you have your both the feet and sit down in a Vajrasana. In a Vajrasana, you can see your spine is straight, supporting your head. It is the activation of a relaxation response, activation of your parasympathetic tone. So people in India, I have seen, after meal, they sit down in a Vajrasana, thunderbolt. Why? Because whole digestive system is parasympathetic. Let me show you a couple of very powerful asanas sitting down. You do an empty stomach called Mondukasana. You use your hand, is like your Adhi Mudra. Put it at the level of your belly button. You breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in a little bit, like your Uddiyani Bandh, and slowly come down. Again, listen to your body's signal. No pain, effortless breathing,
If it come all the way down, you stay here and do your effortless breathing. At home, you stay a little longer. Then you slowly get up. Very good for people with diabetes, with a truncal obesity. We call it your spare tire. Very relaxing, quieting down your mind. Your Shashankasana. Like a rabbit pose. When a rabbit is running around, then it quiets down. Hand goes all the way high up. Put your hand all the way out. Elbows down. Slowly drop your head down and stay here. Stay here and do the breathing. Breathing out longer than breathing in. That is the whole pranayama practice. People always ask me, I want to learn pranayama. Very simple. Keep on doing, breathing out longer than breathing in. The brain will get a signal. That's the way you will be breathing even when you are at sleep. Gomukhasana is a balancing asana. You have one knee, put the other knee in the top. It looks like a cow face called a Gomukhasana. Now you'll see, I want to show you what the balancing means. Let me show you the other way so you will understand that how a proper cow face or Gomukhasana is done. Because Gomukhasana is a relaxation for both lower and upper part of the body. Now I have my right knee on the top of the left knee. My right hand goes high up. I put my left hand here. To put the left hand properly, I set the left hand in the middle, drop my right hand down, touch it, hook it. I literally handshake each other. I'm talking, I'm breathing, and a profound state of relaxation. My whole lower body, upper body, every body is relaxed. Activation of parasympathetic tone, quieting down my mind. I'm in a proper state of healing. Let's look at the opposite side, what happens. Now I'm changing my foot. Now my left knee is in the top of my right knee. Okay? Left hand goes high up. Right hand is come here. I stabilize my right hand again in the proper position. Then I bring my hand down. I'm touching it, hooking it. I'm handshaking each other. Again, I'm staying in the pose. And I'm breathing normally, naturally. So what happens, you will notice, if you practice it, your one side is easier than the other side. You can keep on practicing when I'm talking. That's a very important phenomena. So, when you're in imbalance, your hands will not be equal on both sides. When hands are equal on both sides, you're in a properly balance. Let's do a few, there are a lot of poses you can do. You can do your Ardha Matsyendrasana, you can do your spinal twist, all sitting down asanas, but these are therapeutic asanas. Proper elimination. We have shown about 5 asanas, Shankha Prakshalan. Strong digestion. Strong digestion comes from your Agni. It is called Jathar Agni. Jathar Agni is the digestive fire. The 5 asanas, and you do it laying down. So let me lay down here. Always when you lay down, try to see that your chin is below your head. If you're doing like this, you create a sympathetic response. Try to put something under your head so your chin stays below your forehead. Hands on the both sides. You do Savasana, but for yoga therapy, you know, our every asana is a Savasana because we're in a totally relaxed, we're totally breathing effortlessly, mind is quiet. Put your feet together. First asana is Pada Uttanasana. Pada is a feet raising. Just raise your feet about 30 degrees. Eyes are closed. Stay in the posture. You don't have to go all the way high up. Good. It ignites your Agni. Then you get into called Naukasana. You get your body high up. It's like a boat pose. The boat pose is also improves your digestive fire. Very famous asana laying down, Pavan Mukta Asana. Pavan is a wind releasing pose, but Pavan Mukta Asana is generally balances your Vata. Vata causes your called Visham Agni, but intermittent Agni. Pitta causes your Tikshna Agni, strong Agni. Kapha causes Manda Agni. You can always bend your one knee, bring it up. You can always do the other one and bring it up. It's a very common pose. You don't have to describe it too much. Bring both of them and then slowly wrap your hand. Bring your head high up. Bring your nose touching the knee or chin in front of your knee. Relax. You can roll side to side very nicely. And also you can do front and back. Very nice, relaxed way. 3 asanas. 4, 5, 6 asanas. Jathar Parivartanasana or stomach rotation pose, or you're called Merudanda Sanchalanasana, moving your spine, hands on both sides. Look into your left hand and drop your both the knees on the opposite side. Spinal twist keeps the spine relaxed. Close your eyes and breathe in and out. Very powerful tool. Slowly come back in the middle. Look into your right hand, put the other knees on the opposite side, and stay in the pose. Staying in the pose as a yoga therapy. Eyes closed as if you're sleeping in the pose. How long? Between 5 to 10 breaths. Breathing out longer than breathing in. Setu Bandha Asana. Touch back of your heel with your hand. Bridge pose. Slowly raise your body high up. You clasp your hand. Body will go higher and higher and higher. The body stays at a higher level. You can balance yourself. Raise your one foot high up. Balancing pose. Got the other foot high up. And slowly come down. You come down, slowly come back in the middle. Finally, the real igniter of the Jathar Agni is your Padmasana Asana. You hold your foot, bring it up, touch your big toe to your forehead. Drop it down, bring the other foot, bring it up, touch to your forehead. Finally, you do bring your both the feet high up and slowly bring it and close to your forehead. Powerful relaxation practice. Another powerful relaxation is your abdominal breathing. Laying down, breathe like a baby. If you're new to it, then put your hand over your belly button. Breathe out first. When you breathe in, stomach wall will raise high up. Breathe out, stomach wall will come in. Breathe in. By the time you do about 5, 10, 15, 20, you'll see a proper relaxation will set in. Let me go back and show you some pranayama practice. But before that, just one simple asana, just to show it to you. A lot of people ask me to show them your Mayurasana, Mayuriyasana, Shirshasana. Those are easy. When you can do that, like see here, if you can do a Sarvangasana, there are steps for doing a Sarvangasana, but let me show it to you when you relax, When you relax, you can put your feet in the top, you can get into Sarvangasana right away. Then you can do a Padmasana in a Sarvangasana. You're putting your one foot here, take the other foot, bring it down here. You can see I'm doing a Padmasana on a Sarvangasana. How is it possible? Relaxation. So when you come down, another thing, showed it to you, don't get up. When you get up very slowly, like your turn to one side. There's a lot of controversy, right side and the left side. I can explain to you one day. Get into a fetal position. Use both the hands. Put it down under your head. People takes the time for doing it. For me, my breathing is all normal throughout the whole practice. So I really can do it anytime, any place. I can straighten my other foot, slowly put my hand, I get up, I sit down. So let's do a little pranayama practice for healing. What is a pranayama practice for healing? The first pranayama we did was the exhalation longer than inhalation. Can't beat that, That is your pranayama, and you have been doing throughout the whole practice. My breathing was inhalation longer than exhalation. How do you know? This is this Apple Watch. I have this watch. What is recording? It's recording all my body's vital function, recording my EKG, recording my heart rate. I know exactly what is going on my physical body and mind. We showed you the Bhastrika, active exhalation, active inhalation, going against the grain of your habit. Bhastrika is a very powerful tool. Your Bhastrika is called a Pranayama. Pran means your life force. Pranayama. Pran, yam. Yam means sangyam. Control, restrain. You know how to control, restrain your prana? That is pranayama. So Bhastrika is called a Pranayama. Pradhan means main. And the next one to quiet down your mind is alternate nostril breathing. Why? Because remember, the brain was in an imbalance. Left nostril controls my right brain, right nostril controls my left brain. And I will show you a balancing alternate nostril breathing. I'll show you the techniques, and for you, you do it at home. At home, you put a little beautiful, nice music, put on a light, loose clothes on, and close your eyes and do it. Within a short time, 5-10 breaths, you will see, you will totally enter into a state of almost a transcendental state. Left hand to the mudra, powerful mudra is your Canno Mudra or Henna Mudra. Put it over your knee. Right hand, close your right nostril. You don't have to close all the way down. Just close, just simply under your nostril. You breathe out through your left nostril. Breathe in through your left nostril. Drop your hand down, close your left nostril with the ring finger and little finger. Breathe out through your right nostril. Breathe in through your right nostril. Drop your hand down, close your right nostril with the thumb. Breathe out through your left nostril. Let's do it a few times with this alternate nostril breathing. You keep on doing, and let me tell you the benefit and the physiology behind it. Left nostril is controlled by the right brain. Right brain is intuitive. Right brain is female. Right brain is cooling. Left nostril breathing is called cooling pranayama. Chandra Nari, moon energy. Ida Nari. Right nostril is controlled by the left brain. Left brain is analytical. Left brain is heating. Left brain is male. Right nostril breathing is called Suranari, sun energy. It activates both sides of your brain. It brings the balance, brings the focus. Very powerful tool for people with the dementia, loss of memory, Alzheimer's disease, hypertension, Vata. Many a time you get a little discomfort in this hand. I generally put it over a little tool, or some support. If not, I sometimes put my hand here and keep doing it with my eyes closed. Slowly I bring a focus. How to bring a focus? I take my both index finger and the middle finger, put it at in between the eyebrows, call it third eye, and I continue, close my eyes, continue, alternate nostril breathing. Also to bring the balance back, I do call a super brain yoga. Take the left hand and hold into right earlobe. This is called a super brain balancing. Like you hold the right earlobe with the left hand and left earlobe with the right hand, and keep doing alternate nostril breathing. Within a short time, you will enter into a profound level of relaxation. Practice it at home. Alternate nostril breathing, eyes closed, focusing on third eye, and using your super brain yoga. You can always test between the two nostrils. You always have a difference. One nostril is more open than the other. You can test it. You close your right nostril, breathe in and out through your left nostril. Close your left nostril, breathe in and out through your right nostril. So I have almost equal on both nostrils. I'm relaxed, I'm properly balanced with my practice, but for you, you'll see one nostril is more open than the other side. This is called a Vayu Pradhan Pranayama. It balances your Vayu, means Vata. Third powerful pranayama is called Kapal Bhati Pranayama. Kapal is a forehead, Bhati is a shining. Kapal Bhati Pranayama is called metabolic pranayama. It improves all the metabolic function. It massages all the internal organs, and it also ignites your gastric fire, called Jathar Agni. This is called your Agni Pradhan Pranayam. Agni is the digestive fire. Pradhan is the main. It affects your digestive fire. Use your hand. I will use all the mudras. We do 5 or 10 mudras. Generally what I do about 50 counts of your Kapal Bhati Pranayama in my practice, and I do it each mudras. So what happened with the mudras, eyes closed, Kapal Bhati Pranayama, I always say you get a buy one, get one free, 2 for 1. So start with your Canno Mudra. Bring your awareness to your belly button. There is a balloon here, diaphragm here, balloon here. You push your balloon in, it will hit the diaphragm, all the air will come out. So let me show it to you, somebody who's new to it. You can put your one hand here. You do not do anything about your breathing. Your awareness is here. See, I don't do any breathing. Why? I don't have to do any breathing. The day I was born, I took a deep breath in. I always breathe in. I learned how to breathe out. Going against the grain of my habit. What was my habit was? Active inhalation, passive exhalation. Now here I do a active exhalation, passive inhalation. So let's do a pretty small practice, because I want you to do it at home. I want to do it at home, do it alone, so you'll feel the effect of it. Let's do about 20 counts with each mudra. For Kanna Mudra, you keep on doing it, and I will explain a little bit more. Keep your spine straight. Many a time it is nice to sit in a chair and do it. Keep your spine straight. Very slowly, eyes closed, 1 per second. Remember, Kapal Bhati Pranayama done slowly. You keep on doing it. Let me tell you, doing slowly is pranayama. When you do it rapidly, it becomes a kriya. Same thing as Bhastrika. Bhastrika done very slowly is a Bhastrika Pranayama. Bhastrika done rapidly is called a Shodhan Kriya. Cleansing your kriya is actions. Change your mudra, index finger down, thumb in the top. It massages your internal organs. Massages your liver, massages your stomach, massages your spleen, massages your pancreas, massages your intestine, massages your colon. For female, massages your ovaries, tubes, uterus. For men, it massages your prostate. Massages all the internal organs. After the vital function, all the problems is in these organs here. Change your hand, your Henna Mudra. It also massages your diaphragm. Hits the diaphragm in the top, massages the lower part of the lung. So all the toxic air comes out. I'm breathing in between my practice without doing. Touch your ring finger and thumb, Prithvi Mudra. In between your lung is your heart. It's massaging your heart. So what happens? So somebody's heart stops, but don't stop. You keep on doing it. We do a CPR called cardiopulmonary resuscitation. We do chest compression. We do chest compression to massage the heart. So what is doing? It's massaging the heart inside. Touch your little finger and thumb, Varun Mudra. You can feel it is hitting your diaphragm, hitting lower part of the lung and the heart, lower part of the heart. So I call it a internal CPR, cardiopulmonary resuscitation. In fact, we also tell people who are having some chest discomfort or even maybe a chest pain, when you're calling 911, keep on doing very gentle Kapal Bhati Pranayama. I recommend it for the people with heart disease, the very slow Kapal Bhati Pranayama. Touch your ring finger, little finger and thumb, and you always notice I always do pranayama with my eyes closed. When your eyes closed, you can look at your subtle body. A subtle body, body of your mind. What is the body of your mind? And the causal body, body of your spirit. Touch your middle finger, ring finger and thumb. Apna Mudra. So when you know you can see your subtle body, you can access any part of your body. I can see my knee, I can see my ankle, see my foot, see my spine. I even see my body. I can see I'm in a sattvic space, I'm entering into sattvic space. I'm doing my practice over there. Also, to show you something, I've been there almost close to 2 hours. I'm doing all the talking, but still, I didn't drink any water. I still have a lot of saliva in my mouth. Index finger down, Apna Hridaya Mudra for cardiopulmonary function. You can do Linga Mudra and also do a Kapalbhati Pranayama. Linga Mudra helps your flames. You'll see the babies or children do like all the time Linga Mudra. This brings the awareness in your body and mind, quiets down your mind. When it quiets down your mind, you access your subtle body. The subtle body, if you see what I'm talking about, what the subtle body means, see, I always change, so I bring the balance back in the body. So my eyes are closed, and my index finger to the tip of my nostril. Left hand at the tip of my nostril, touching my crown of my head, touching my left knee. I'm touching my right great toe, touching my left little finger. I can access my whole body, there's my belly button. So let's do a meditative alternate nostril breathing. Meditative alternate nostril breathing, you will do alternate nostril breathing without closing your nostril. This will take you to meditation. I'll bring it down to your level of meditation. We have already done the Bhramari Pranayama. I will do very gentle Ujjayi Pranayama. And we have a lot of pranayam, Sitali Pranayam, Sitkari Pranayam. I'll do a little Ujjayi Pranayam. Then we'll go to your chakra awakening meditation, which is the therapeutic meditation. So the way you do it, touch your index finger and thumb, close your eyes and visualize your left nostril. Breathe out through your left nostril. Then breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. I can clearly see my air is coming through my left nostril. Air is going out through the right nostril. I do it a few times with my eyes closed. Slowly enter into a meditation. Meditation is a state of mind when you develop a gap in between your thought process. Keep doing it. Let me tell you the effect of meditation. Our mind generates the thought process. thousands and thousands of them, 30, 40 thought process in a minute, 30, 40,000 thought process. Almost all the thoughts are in the past, majority is in the, and large number in the future, very little in the present. So practice of yoga is living in present. Out of all the thought process, 95, 98% is a repeat thought process. I have to start Facebook Live at 9:30. I have to teach a class, yoga therapy for cellular healing, continuously chattering my mind. In a meditation, you go in between the thought process. Extend the space in between thought process. The gap becomes bigger and bigger and bigger. So you are not thoughtless. You still have the thought, but you don't have the repeat thought process. The chattering of the mind goes away. Chitta vritti nirodha. People says, I can never get to mind quite down. Mind is like your sun. Some cloud will come. Cloud comes in front of the sun. The cloud goes away. It's a wonderful meditative alternate nostril breathing. Bhramari Pranayama, closing your all the five senses and creating, just to show you one more time, index finger in the forehead, 3 fingers closing your eyes, thumb to close your ear, close your mouth. You shut down your vision, your hearing, and your smell and the taste. So breathe out first, take a deep breath in and breathe out with the sound of a bee. And at home, you keep on doing it 3 times, 5 times, 7 times. More and more you do the Bhramari Pranayama. It is a healing for your chronic diseases and proper healing of your body and mind. One powerful healing is the locks and the chin lock. The way to do the chin lock, either relax your hands with Adi Mudra, keep your head straight, slowly drop your chin down, touch the chin to the chest. It activates your carotid sinuses. It is a very calming, quieting for your cardiovascular system and a nervous system. You incorporate with your Abhantarin Kubha, means breath holding in inhalation. When you do breath holding in inhalation and cause your chin lock, it causes your profound relaxation and is called your Murcha Pranaya. So breathe out first. Take a deep breath in. Completely breathe out. Take a deep breath again. Hold your breath. Slowly drop your chin down. Touch your chin to your chest. And then you feel that the whole relaxation is setting in. And hold it and keep counting. 1 and 2 and a 3 and a 4 and a 5. You can also do called abdominal lock. It is again breath holding in exhalation. Breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. And in that posture also, you can Contract your pelvic floor and pull it up. This is called a root lock, Mula Bandh. Then you can incorporate your chin lock. This is called a great lock. It's a wonderful practice. Ujjayi Pranayama followed by your Chakra awakening meditation. That will be the end of our practice. Ujjayi Pranayama, your larynx is relaxed. Larynx is not tight. When larynx is relaxed, when it's contracted, and you try to breathe in through a relaxed, contracted larynx. Larynx is supplied by both superior and inferior laryngeal nerve. And this is the branch of your vagus nerve. So vagus nerve, all the information goes to your brainstem, and the brainstem comes out through glossopharyngeal nerve, the nerve supplying your soft palate, and hypoglossal nerve is your tongue. It tightens up your palatopharyngeus and glossopharyngeus muscle. It literally cures your snoring. It pushes the tongue in front as a therapy for your sleep apnea. So the way to do it is that breathe out first. Take a deep breath in. Completely breathe out. When you get a little cough, it's normal because cough comes from the same place. Again, breathe out first. It continue a lot longer. Initially, if you want to learn, you can do a little spurt like this. Trying to breathe in through a constricted larynx, but in a relaxed way. It's a very important tool for called Ujjayi, victorious pranayama. When you close your eyes, the yogis saw all the color in front of their eyes. But the important color they have seen, called color of the rainbows. Rainbow has 7 colors: violet, indigo, blue, green, yellow, orange, red. They assign those colors along the line of the spine, and they assign the energy centers in each spine. They call them chakra, the wheel. They connected them with the nervous plexuses, endocrine glands, systems for the body. Violet is here in the crown chakra, connected to the nervous system, and it is an imbalance. And there are sounds called mantra. Mantra means man means mind, tra means quiet down. So mantras balances your chakras. I'll show you all the mantras and all the 7 chakras. Indigo is in between us, called Aga chakra. It's connected to your endocrine glands and also connected to your pituitary glands. Here is connected to the pineal glands. Violet is your Vishuddha chakra, the throat, connected to respiratory system, and your thyroid and parathyroid gland. Green is the level of a heart, called Anahata chakra, or heart chakra, connected to cardiovascular system, and the thymus, cardiac plexus. Manipur chakra at the level of a belly button, and it is connected to your gastrointestinal system. Each one has a color. Remember, there's a green, this will be a yellow, and all has a structure. I'll go through the 10 petals. Connected to your solar plexus chakra. Between your belly button and the root of the spine is your Shadhisthana chakra, or a pelvic chakra, connected to reproductive system, or your gonads, your reproductive glands. And finally, at your root chakra, the Muladhara chakra, at the level of the spine. All of them are in imbalance. You have asanas, pranayamas, you get mudras, but you also mantras. Lam, vam, ram, yam, ham, sham, om. So we'll do this chakra awakening meditation. We'll finish. See again, I have a lot of saliva in my mouth. Touch your index finger and thumb. Put it over your knees. Close your eyes. Bring your awareness in the root of the spine and visualize a red colored chakra. It has 4 petals connected to musculoskeletal system. It is in imbalance. So breathe out first. Take a deep breath in. Lam. Bring your awareness between your belly button and the root of the spine. Svadhisthana chakra, pelvic chakra. Color is orange. It has 6 petals connected to reproductive system. Sound to balance is a vam, V like a victory. So breathe out first. Take a deep breath in. Vam. Bring your awareness to your belly button. Manipur Chakra. Color is yellow, about 10 petals, connected to gastrointestinal system. Sound to balance this chakra is rum, or like a rubber. Breathe out first. Take a deep breath in. Rum. Bring your awareness to the heart chakra. Color is green. It has 12 petals, so 12 sides connected to cardiovascular system. Sound to balance the chakra is yam, Y like a yellow. So breathe out first. Take a deep breath in. Yam. Bring your awareness to the throat chakra. Color is blue. 16 petals connected to your respiratory system. Sound to balance the chakra is hum, H like in Harry. So breathe out first. Take a deep breath in. Hum. Bring your awareness in between the eyebrows, Agga chakra. Color is indigo. 2 petals connected to your endocrine system. Sound to balance this chakra is the sham, S-H. So breathe out first. Take a deep breath in. Sham. Bring your awareness to the crown of your head, crown chakra, Sahasra chakra. Color is violet. 1,000 petals connected to nervous system. The sound to balance the chakra is Om. In yogic tradition, Om has 3 components, A, U, Ma. A comes from the lower part of the lung, U comes from the middle part of the lung, Ma comes from the upper part of the lung. Again, breathe out first. Take a deep breath in. Slowly bring your hands in the front, touch your little finger and thumb, separate your ring finger, middle finger and index finger. This is a Padma Mudra. Lotus Mudra connects your body and mind. Your heart is the site of the soul. Bring it close to your heart. Heart and mind is connected, and we always bring the wellness. The whole cellular healing comes from physical wellness, mental wellness, spiritual wellness. Physical wellness prepares our body with your sthiram, sukham, asanam. It also gives us strength and stamina, but final relaxation, final healing takes place through your mental wellness and spiritual wellness. Slowly bring your hands in front of your heart mudra. Bow your head down. It is a gesture called namaste. I honor the divinity within you. You are divine. Slowly rub your hands. Slowly rub your hands. When you feel the warmth in your hand, called palming and cupping, slowly take both the hands. If you're wearing glasses, remove your glasses. Put your hands over the eyes. Massage your forehead. Massage your face and head and neck. It's a very powerful relaxation response. This completes your total cellular healing. You're completely healed. You are in a state of disease-free, medication-free, enjoying a good quality life. We have all the monitors here. We can look at our EKG, look at our heart rate, look at all functions, and thank you for participating and watching. I'm going to look at all the comments and going to answer all the comments. For me, it is very hard to take a look at the comments and answer. I request you for the next class, if you send me the questions beforehand, I will be able to answer during the practice.